Your blood vessels are currently carrying an immense, invisible load, a mechanical pressure pushing relentlessly against every artery wall inside you. This physical force occurs deep within your brain, inside your kidneys, and throughout the delicate vessels feeding your beating heart right now. Blood pressure is not just a simple reading at a doctor's office that gets written down and filed away for years. It is a constant physical force that, over months and years, fundamentally reshapes how your vessels behave and your heart works. This pressure determines whether your vital organs stay functional and healthy into your 70s, or if they fail much sooner than expected. Hypertension remains the most common undermedicated disease process in the developed world, silently affecting millions of people without any obvious warning signs. It rarely announces itself with pain or fatigue until the damage is already done and often irreversible within your system. Usually, it arrives in the form of a sudden stroke, a massive heart attack, kidney failure, or the onset of dementia. The problem is that for half a century, we have been told that the main villain in this story is salt. We were told to cut sodium and pressure would drop, except that strategy has not worked for most people struggling today. What we are now understanding is that sugar has been driving blood pressure up through a completely different and hidden route. This route does not involve simple water retention, but instead locks your kidneys and arteries into a high-pressure state hormonally. Most people have been treating the wrong mechanism. Hi, I am Dr. Alex, an emergency medicine doctor with 10 years experience. After nearly 10 years in the A&E, I have seen exactly what happens when preventable disease is not actually prevented. My goal now is to help people avoid these tragedies in the first place and live longer, healthier, and happier lives. For the next couple of minutes, before discussing sugar, we need to understand what creates blood pressure in the first place. Blood pressure is the product of three forces. The first is cardiac output, how much blood your heart pushes out. The second force is blood volume, which is simply the total amount of fluid circulating in your system right now. The third force is vascular resistance, which is how relaxed or constricted your arteries are at any given moment in time. If any one of those three goes up, pressure rises. If all three go up together, your pressure climbs dangerously high. Cardiac output is controlled by heart rate and stroke volume, both responding to adrenaline and your autonomic nervous system signals. Blood volume is controlled by your kidneys, which decide precisely how much sodium and water to hold on to or excrete. Vascular resistance is controlled by the endothelium, the thin layer of cells lining every artery, which produces protective nitric oxide. When nitric oxide production falls, vessels stiffen, resistance climbs, and pressure rises, even if your heart rate hasn't changed at all. What becomes clear is that your blood pressure isn't just one problem, but the downstream result of complex system interactions. It is the result of kidney signaling, endothelial health, autonomic tone, and arterial compliance, all interacting at the exact same time. That is why blanket advice like eat less salt works for some people and does almost nothing for many others. The question isn't just what you eat, it is which part of your pressure system is breaking down and why. If you are watching this video, you are probably worried about your health, and I want to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest medical research. My aim is to help you live longer and prevent the diseases I see in the emergency department every single day. All I ask in return is that you give this fairly new channel a chance and hit the subscribe button today. If you get to the end and didn't think it was worth your time, then feel free to unsubscribe later. But if you give me your time and attention, I will give you everything I have learned from over a decade. So please, help me out. Hit the subscribe button to help this channel reach more people like you. Let's continue. Salt has been the primary target of blood pressure advice since the 1970 seconds, and there is a scientific reason for that. Sodium is osmotically active, which simply means wherever sodium goes, water follows it closely to maintain a chemical balance. When you eat a meal high in salt, sodium gets absorbed, and your body pulls water in to dilute it. That increases your plasma volume temporarily, and more fluid in a closed circulatory system means higher pressure. It is basic mechanics. The kidneys respond to that pressure rise by activating the body's emergency pressure regulating network to handle the extra load. When blood pressure climbs, healthy kidneys sense it and start excreting more sodium and water to bring the volume down. This is a tightly controlled feedback loop, and in a healthy metabolic state, it works beautifully to stabilize your system. You eat more salt one day, your kidneys clear it out, and your pressure stabilizes without any long-term permanent change. The problem is that salt sensitivity exists on a spectrum. Some people handle it well, while others struggle significantly. People with impaired kidney function or certain genetic variants experience dramatic blood pressure rises from sodium intake due to poor filtration. Others can consume high amounts of salt and show almost no pressure response because their vessels are still flexible enough. What we have learned is that salt primarily modulates pressure through water retention and plasma volume expansion, not metabolic damage. And that distinction matters because it means salt is a volume problem, not a disease driver in itself for most. So sugar operates through a completely different mechanism, and it is one that most people have never even heard about. When you eat refined carbohydrates or sugar, your blood glucose rises, and your pancreas releases insulin to shuttle that glucose. That is the story most people know. What they don't know is that insulin also signals the kidneys to retain sodium, not because you have eaten more salt, but because insulin itself is a sodium-retaining hormone that prevents normal excretion. The more insulin you produce, the more sodium your kidneys absorb, and the more water gets pulled into your bloodstream. This creates a pressure rise having nothing to do with salt. You could be on a low-sodium diet and suffer. If your insulin is chronically elevated because you are eating processed carbs, your kidneys are told hormonally to retain sodium. That is the first pathway. The second is that chronic insulin elevation activates the sympathetic nervous system, increasing your heart rate. It boosts cardiac output and constricts peripheral blood vessels. More output means more resistance and significantly higher pressure. Now, the third pathway involves fructose, which is metabolized in the liver. When broken down, it generates uric acid. Elevated uric acid has been shown to impair endothelial function, meaning it reduces nitric oxide and prevents arteries from relaxing. It also increases renal sodium reabsorption directly. So fructose chemically alters how your kidneys handle sodium and respond to pressure. Sugar is a dual-action driver of hypertension, working through both kidney signaling and arterial stiffness, regardless of salt intake. Now, the interaction between insulin and sodium is where the real trap lives for most people struggling with blood pressure. In a healthy person, insulin rises, signals sodium retention temporarily, then falls, allowing the kidneys to release that sodium naturally. But in someone with insulin resistance, which describes the majority of adults today, insulin does not fall back to baseline. It stays elevated because cells aren't responding. So the pancreas must keep producing more, just to maintain normal blood sugar. When insulin is chronically high, the kidneys never get the signal to release sodium. They are locked into retention mode. This is why so many patients reduce their salt intake to see almost no change. They are treating the wrong side. They are treating the volume side of the equation while the hormonal control system is still holding on to sodium. The kidneys aren't passive filters. They are hormonally controlled pressure valves. And if the hormones are wrong, the valve stays closed. What makes this worse is that insulin resistance also damages the endothelium. High insulin levels over time reduce nitric oxide. So you end up with a system where blood volume is artificially expanded and vascular resistance is climbing simultaneously. Both arms of the blood pressure equation are being driven up at once, and cutting salt alone addresses neither of them. This is the metabolic pressure trap, and it is why lifestyle advice focused only on sodium reduction has failed for many. If you look at the foods that dominate modern diets, you will notice they don't just contain salt or sugar alone. They contain both, engineered in specific ratios to maximize palatability and consumption. It is deliberate food design. A single serving of many ready meals or fast food items will deliver high sodium and high refined carbs together. That combination is not accidental, and the effect on blood pressure is far worse than either ingredient acting alone. You are getting sodium that expands plasma volume, and you are getting refined carbs that spike insulin and lock your kidneys. The result is that your blood pressure goes up from the volume load and stays up because the release signal never arrives. You are hitting both pathways simultaneously. The sodium creates the initial pressure rise, and the sugar prevents your body from correcting it. That is why ultra-processed diets are so closely linked to hypertension, often more strongly than salt intake alone. Now, what complicates this further is that many processed foods are also low in potassium, the counterbalance to sodium. Potassium helps the kidneys excrete sodium and supports vascular relaxation. It is the natural antidote your body expects. Whole foods like vegetables, legumes, and unprocessed meats are naturally high in potassium and relatively low in sodium. Processed foods invert that ratio. You end up with high sodium, low potassium, high refined carbs, and often high fructose. It is a perfect storm for pressure dysregulation. It explains why hypertension is overwhelmingly a disease of industrial food systems. It is not a problem caused by people simply seasoning their home-cooked meals with a little bit of salt. When we understand what drives blood pressure up, we automatically understand what brings it down. It is two sides of the same coin. Biologically speaking, blood pressure falls when three specific things happen within the body to restore balance. The first is that insulin drops and stays low. This allows the kidneys to release sodium normally again rather than hoarding it. The second mechanism involves endothelial nitric oxide production increasing, which essentially relaxes our blood vessels and reduces resistance. The third lever is when renal sodium handling normalizes, meaning the kidneys respond to actual sodium intake, not hormonal locks. Here is the key point. Everything that genuinely lowers blood pressure long-term works through one or more of those mechanisms. Everything. Let me give you some concrete examples of how this works in practice with lifestyle changes. Physical activity is powerful. When you exercise, you create shear stress on your vessel walls, stimulating the endothelium. This stimulates the inner lining of your blood vessels to produce more nitric oxide, directly lowering vascular resistance. That effect doesn't stop when you finish. It lasts for hours, which is why regular movement creates sustained pressure reduction. I am not talking about burning calories. I am talking about turning your endothelium into an active drug factory for relaxation. Now, diet. Dietary fiber works through the insulin pathway. Fiber slows glucose absorption, which flattens blood sugar spikes. This reduces the amount of insulin your pancreas produces. Lower insulin means kidneys aren't signaled to retain sodium constantly. Then we have sleep, which affects pressure through the autonomic nervous system. Poor sleep increases sympathetic tone and stress. Deep restorative sleep allows the parasympathetic system to take over, lowering cardiac output and vascular resistance at the same time. It is literally like switching from the accelerator to the brake for your cardiovascular system. Here is the bottom line. Blood pressure reduction isn't about cutting one ingredient or taking one magic supplement. What we are talking about is a systems-wide hormonal recalibration, restoring the biological conditions your body was designed for. In emergency medicine, we see blood pressure in its most dangerous forms: hypertensive crisis, strokes, and heart failure. What becomes obvious is that medication controls pressure, but it doesn't reverse the disease process driving it. An ACE inhibitor reduces signaling to lower resistance. A diuretic forces kidneys to excrete sodium. They force changes mechanically. A calcium channel blocker relaxes arterial muscle. These medications save lives, but they don't fix why pressure was high. What I have seen is that blood pressure medications work best when the metabolic drivers are already improving through lifestyle. A patient losing visceral fat and eating whole foods will often need lower doses to achieve the same safety targets. That is because the medication is acting on a system that is already starting to regulate itself better hormonally. There is a distinction. Young, lean patients often respond to salt restriction because their vessels are flexible enough to adjust. Older patients with insulin resistance rarely see meaningful change from salt restriction alone because their pressure is driven hormonally. That doesn't mean salt doesn't matter. It means salt isn't the primary driver, and treating it as such causes frustration. Clinically, The patients who reverse hypertension are the ones who address the metabolic foundation, not those obsessing over seasoning. So where does this leave us? The real answer is they are not opposing forces, but different mechanisms on the same system. And in modern diets, they almost always appear together. Salt raises pressure temporarily by expanding plasma volume mechanics. Sugar locks blood pressure chronically by elevating insulin, impairing endothelial function, and preventing the kidneys from releasing sodium. The reason decades of advice haven't solved the crisis is that we treated volume while ignoring the hormonal side. You cannot fix a hormonally locked system just by reducing sodium intake. The kidneys wouldn't release it anyway. What actually lowers blood pressure for good is restoring the hormonal environment that allows kidneys to regulate sodium properly. This allows vessels to relax normally and cardiac output to settle. That happens when insulin falls and nitric oxide rises. It happens when processed food is replaced with whole food. Processed food is the real villain, weaponizing both ingredients. It delivers sodium for the acute volume rise and refined carbs for the chronic hormonal lock simultaneously. And it does this in a low potassium, low fiber context that prevents your body from correcting the damage naturally. Hypertension is not fundamentally a salt problem or a sugar problem. It is a processed food problem, breaking regulation. It breaks blood pressure regulation at multiple points in the system. Fix the food, and you fix the system. I hope this explanation helps you understand your body better and gives you the tools to take control today. Thank you for giving me your time and attention. It means a lot to share this vital information with you. And finally, just to end, please subscribe to the channel if you found this video useful for your health. Help me reach more people like you who need to hear this message. Share this with someone you love. Together, we can prevent preventable diseases and build a future where we stay healthy well into our later years. I am Dr. Alex. Stay safe, eat whole foods, and take care of your pressure. I will see you next time. Remember, your health is your most valuable asset. Protect it with knowledge. Thanks for watching Smart Wellness Tips. Check out these other videos on the screen now to learn more about insulin resistance and protecting your heart. Knowledge is power, and applying that knowledge is the first step toward a longer, happier, and healthier life. Please remember, this content is for educational purposes. Always consult your own doctor before making significant medical changes. This video was researched and produced to bring you the highest quality medical information available in a simple format. We appreciate your support. Every like and comment helps the algorithm show this life-saving info to others. If you haven't clicked that button yet, now is the perfect time. Join our community of wellness seekers. Make your next meal a whole food meal. Your arteries, your kidneys, and your heart will thank you for it. As the old saying goes, let food be thy medicine. It is the most powerful prescription you can write yourself. We are dedicated to uncovering the truth about health, cutting through the noise, and bringing you clarity. Turn on notifications so you never miss an update. We have many more deep dives coming soon. Thank you for watching all the way to the end. Your attention span is an investment in your future. Take a deep breath, relax your shoulders, and go forward with confidence in your new understanding of health. See you in the next video. Stay healthy, stay smart, and keep learning about your amazing body. This has been a presentation by Smart Wellness Tips, dedicated to your journey towards a better life. Goodbye for now. Don't forget to subscribe, and have a wonderful, healthy day ahead. Smart Wellness Tips, signing off.